I'll call the February 27th Branch Hillsdale St. Joseph Board of Health meeting to order. If you will all join me for the Pledge of Allegiance.
Sure.
I pledge allegiance to the flag
Of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice.
Thank you. I am privileged to serve for our chairman, who is not with us today and conducting the meeting. And so, Teresa, would you please call the roll?
Commissioner Hoffmaster.
Here.
Commissioner House.
Here.
Commissioner Leininger.
Here.
Commissioner Collins.
Here.
Commissioner Schaefer.
Here.
Commissioner Stoll.
5 members present for our bylaws. That does constitute a quorum. Item 1C, approval of the agenda.
Make a motion, we approve the agenda as presented. I love the board. Thank you.
I have a motion from Mr. Hoffmaster and support from Mr. House to approve the agenda as presented. I know he's been so long.
We hesitated.
Doesn't roll off.
To approve the agenda as presented. Any discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Next up is letter D, approval of the minutes from the January 23rd, 2025 Board of Health meeting. Those minutes are attached for our review. Any discussion on those, or I'll entertain a motion to approve as presented.
So moved, Mr. Chairman.
I'll support. I have a motion from Commissioner Schaefer, support from Commissioner Collins to approve the minute as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Next up is that time when we open the podium to anybody from the public who is here who would like to address the Board of Health. I would remind the public that we do have 3-minute time limit, and we would ask you to state your name before as you begin. Do we have any individuals from the public who would like to address it? I've beaten down the door. Rebecca, the health officer's report. Good morning, ma'am.
Good morning. Thank you. All right, so I start off with a reminder that we're looking at bylaws today. You addressed that issue in January. The 10-day waiting period has been completed, so that's on the agenda. We do have some personnel policy updates after all. When I was preparing this report, we didn't have any new legislation yet, but in your or at your place, you have a very thick packet that we will, I'm sure, discuss later in the meeting today. Our environmental health electronic application portal, wanted to just give you a quick update on that. We did find a couple of issues with regards to how payments are reported to us that we need to work out with Hedgehog and our payment provider Square. So Joe is working to address those issues. We were going to, by this point in the year, get out a big, splash, the portal's available, and so we've held off on doing that public announcement. It is still available. It can still be done.
Sorry, I
Yeah.
highlighted this at the Board of Commissioners meeting in January and went through.
Yeah, and we've had a few people use it, and that's fine. We're struggling with some of the information that comes through on the payment to match it up. So we'll get it worked out.
We will.
So until that time, we'll hold off on doing a huge public splash. Our staffing update, we have 2 nursing positions and now a breastfeeding care position open. So although I do think one of those nursing positions we might be close to filling, we had a breastfeeding peer let us know yesterday that she needs to leave employment. So we'll be looking for a new breastfeeding peer for Branch County. That is a part-time position. The No Wrong Door grant that the Area Agency on Aging, Laura's group, applied for in combination with 3B and 3A, those 2 AAAs and Southwest Michigan Disability. I'm probably saying that wrong. Yep. We were awarded And so 3B is the fiduciary on that and the lead. They're working out some stuff, but we are at a point where we've been notified of our grant amount. And we need to move forward on a request to add a staff member to do the work for that No Wrong Door grant. So that's in your packet today as well. Wanted to take a moment to talk about respiratory virus season. I wouldn't be surprised if others today talk about that. We continue to be very high in Michigan and in most areas actually of the US. It's a particularly bad flu season in relation to recent years past. There have been, at the time of my typing this, 68 influenza-associated pediatric deaths nationally. The state of Michigan put out a press release about 2 in Michigan just last week. And so we want to continue to remind folks that that vaccination for influenza is available. And we can provide that, your local pharmacy can provide that. You can go to your provider for that. There are other respiratory disease vaccines also, but the point of the vaccine is to minimize symptoms and hopefully keep you out of the hospital. So we don't want to miss the opportunity to encourage that vaccination. Couple of public health concerns that I wanted to highlight today. One is the blood-led universal testing rules. This is legislation that was signed in October of 2023 and then went through the process with the Joint Committee on Administrative Rules. We are waiting for the Joint Committee to finalize those rules yet. There was thought that it would be done by the end of 2024, but we are now obviously into 2025. The Childhood Lead Poisoning Prevention Program, part of MDHHS, is expecting final rules to be approved at any time, and they are working to update informational materials. Highly pathogenic avian influenza or bird flu, lots of conversation all over about that, of course. Since January, there's been 2 additional backyard flock detections. I think we got a notification on one again yesterday in the state of Michigan. You know, this virus could mutate. There's concern about that, and then it making the leap so that it can be more easily transmitted to human population. So that's why it's not only the cost of eggs that make this concern. It's the fact that this is such a hardy guy and it could mutate and change and jump into the human population, creating another pandemic. Finally, I wanted to mention measles today. There is a measles outbreak in Texas with, again, when I was typing this, I reported 58 cases. There are more now. Measles is a highly contagious vaccine preventable disease caused by a virus that most severely affects children. The virus is highly contagious. 90% of unvaccinated people who are exposed end up contracting it, with 1 in 5 of those people being hospitalized. Measles is spread through contact with infected nasal or throat secretions. It's airborne, most commonly spread through coughing, sneezing, or breathing, and remains contagious in the air and on surfaces for up to 2 hours. About 1 in 3 of every 1,000 children who become infected with measles will die from respiratory and neurological complications, according to the CDC. This is a vaccine preventable and was previously eliminated in the US in 2000. Nationwide and here in Branch Hillsdale and St. Joseph counties, childhood immunization rates against serious diseases like measles are declining, resulting in increased incidences and resurgence of this and other vaccine preventable diseases. Our concern is that what's happening in Texas will continue to spread throughout the United States and make its way.
Rebecca, this is a part of like the early childhood vaccine zone
Yes.
for the kids.
Yes.
MMR, measles, mumps, rubella.
And Heidi can tell you when those were given, if you're interested. Want to rattle it off or don't you know?
2 months and 4 months.
All right, so some building projects in our Coldwater office. I have received the specification sheet on the restroom and clinic counter upgrades for this building. These projects still need to be bid out and then scheduled. I've asked the new county administrator, Frank Walsh, for information on the HVAC upgrade and when that project will begin. Did we get that back on the HVAC? Do you remember? No. So I'll have to reach back out to Mr. Walsh. In the Hillsdale office, we are requesting approval today to add more doors to the fob system in an effort to continue to make that building more secure. And so that'll be on your agenda later. Nothing to report for Sturgis location at this time, but I have started to meet with contractors on painting the Three Rivers office and hope to have bids for the March meeting of the Finance Committee so that we can start moving forward on that. And that's what I have for you today.
Any questions for the health officer? I have a couple
Yes,
in regards to the Hillsdale office,
yes.
water softener.
Well, I was waiting for MCDC to tell me that they needed it for their equipment, and they have, although prompted several times, have never indicated to me that it is necessary for them. So at this point, I'm letting it go.
Okay. The other thing is, I know we have talked in the past about potentially getting the soffit and fascia of that building wrapped like we did with the building over in Three Rivers. Where are we at in that process?
So the same contractor that led our project in Three Rivers came over to the Hillsdale building and walked around with us. We're looking for him to write up a specification sheet so that we can put it out for bid. That's where we're at. At this point, Teresa and I are looking at next fiscal year.
Yeah, so the money we were gonna use to pay for that, because we have a grant, with the cost of the renovations of the bathrooms here and the new HVAC, we've pushed that into next year.
But we have started the process and we'll be ready to collect those bids so that we're ready to go in October of 2026.
What are-
or 2020.
What is our anticipated cost on that bathroom and the HVAC? Because I know we'll pay 60% of that.
Your number?
I'm gonna look it up for you. 'Cause I do know what it is.
While we're waiting, I just want to clarify that MMR is 12 months and 4 years.
Thank you. Sorry.
Yeah.
The estimated, I know the estimation on the bathroom encounter was 60 something, 60
The
something.
the total amount,
Mhm. But that's the total, that's not our
Right.
piece.
36.
Yeah, I think it was
40,000.
62 on that, but I'm looking. Okay.
Yeah.
And then the HVAC was quite a bit more than that.
So the HVAC was 174,800, and we would get 60% of that, and 62,000 for the bathrooms, and we would get 60%.
Thank you.
You're welcome. Thank you. Hearing no other questions, we will proceed on with the medical director, Dr. Lucarello.
Thank you for looking at my video last. I every January, I didn't want to complain, but every January there is a big ophthalmology meeting in Hawaii and Ortiz Islands. And it's a very, very good meeting. So and they do a wonderful job. It starts at like 6 a.m. because you're up then because of the time change. And you're done by like 12 or 1, and then you have some time. And so I didn't want to make it sound like I was at a meeting and suffering. I'm really enjoying myself, and it's a great meeting. It's very good information.
What island this year?
This year we were on Oahu, and what we've been, it kind of rotates: Big Island, Oahu, Maui, and it kind of just spins around. So they're really so good place to go for a meeting. You have to go to a meeting.
Bankers and Bell.
Yeah, yeah. It's a big.
Minnesota, Iowa,
Yeah.
But the price of eggs, so obviously food in Hawaii is ridiculous, right? It's all imported. And we couldn't even find eggs. So when we did find eggs, I was like, oh, some eggs. And I looked and I was like, $12. And I picked it up and there were 4 eggs for $12.
Oh my.
So, so needless to say, we had no eggs that week. And the meeting served breakfast and they never did eggs either. So they really, it was a lot of fruit,
Oh, well,
pancakes, and no eggs.
you should have gone to Maui, because last time I was there, well, Maui and Hawaii, the chickens are free range.
Yes.
All over the place.
A
It's
lot.
like, there should be all kinds of eggs.
So I don't understand. I'm like, they're walking around everywhere, bothering you. So, all right. Well, my report is in the packet. Again, we're going to repeat a lot today about communicable diseases, especially respiratory things. And I'm going to talk a little on influenza. The TB, our TB patients and our latent TB patients are, I think, being well taken care of, and probably mostly for the new commissioners, it's very labor intensive to take care of those patients. There's lots of language barriers. We check in with them frequently. The active TB patients, we do direct observation of their therapy. So we go to their homes, we watch them take their pills daily, sometimes Saturdays and Sundays. So it's a lot of labor for the nurses here. So we're working on trying to streamline things and getting patients to kind of come at the same afternoon, etc. So getting on all of that. I'm planning on attending the day at the Capitol in April with Chris. So we will be meeting with our people and bringing some ideas and thoughts to them as well. All right, so influenza. So we all know about influenza, especially this time of the year, and this season in particular. It's really difficult, right? Because when you go in, do you have influenza, or do you have COVID, or do you have RSV, or do you have something else? So a lot of these statistics that we look at are estimates, right? Because I'm not home checking myself for influenza every time I don't feel well. So these statistics are coming from hospitals and doctors' offices that check, but you can imagine how many people, right? So at work, I see people all day long and I think I had the flu. I might have had the flu. I'm still coughing. Maybe I still have the flu, and I'm sure you see that in every realm of work where people are sick this time of the year and everybody's coughing and sneezing, and you're seeing less and less masking. So kind of think, we have some guidelines. If you were sick and you're feeling better, you should probably still wear a mask when you go out in public for lots of these respiratory illnesses. So it would be lovely if people would be more conscientious about respecting other people and maybe their chronic illnesses. So it's a virus, and it affects our nose, throat, and lungs. And we worry mostly about older people and children, and any people with health risks, right? Diabetes, hypertension, again, any autoimmune disease, we're very worried about them getting. We've all heard about type A and B. Those are the two most common. Actually, A is 96.6% in the last several years is influenza. So B might act a little differently in kids. So we kind of look for those signs and symptoms to try to determine which ones they are, but we can test for the flu and we can test to see if it's A or B as well. The best way to reduce the risk is, again, to get your vaccination. And people will think, I got vaccinated. I'll hear this all the time. Got vaccinated the last 2 years and I got the flu the last few years. So my response to that is typically, how sick did you get from the flu, right? Would you end up in the hospital for the flu? Maybe your vaccine prevented you from being hospitalized. So we need to keep reminding people that the flu vaccine does not prevent the flu. Okay, so you can get the flu, but we hope that it lessens all of the ramifications of it. And we all know that flu can lead to death, especially from the statistics that Rebecca gave this morning. So very scary. You will have a fever sometimes. You will have a cough, sore throat, runny nose, muscle and body aches, headaches. And then some people will get some vomiting and diarrhea, which we wouldn't think would come from a respiratory illness, but that's mostly in children. And sometimes that makes us think of influenza B. So I have some stats from 2021 to 2022. Those are kind of the most recent established set in stone. And 9 million people with flu. 100,000 hospitalizations and 5,000 flu deaths for that season. So pretty significant. And how does it spread? Similarly to the measles. So someone with the flu talks near you, coughs and sneezes near you. it goes into your respiratory system, and it can last on surfaces even longer than the measles, sometimes up to 48 hours. So you might touch a surface, touch your nose, touch your face, touch your mouth, and then you're good. About 8% of the US population gets sick each year from the flu. And then again, children, adults, we worry more about 65 and over, mostly because of their comorbid conditions. And so the other scary thing for me about the flu and lots of these respiratory things are the period of contagiousness. So I might not even know that I have the flu yet, and I'm at work and I'm spreading it around, and I can spread it for a few days before I even get any symptoms. So that's the scary part, and that's probably why this spreads so quickly around, right? We don't even know we have it. And then you're most contagious those 3 to 4 days after you get some symptoms. So when those people are blowing their noses and coughing and saying, I think it's sinus. And we're going, I think it's the flu. It's probably the flu. So we're not spreading sinus disease usually to each other, but we are spreading other respiratory illnesses. So complications, again, you can get ear infections, pneumonia, severe congestive heart failure, asthma. It can just wreak havoc on your diabetes if you're already diabetic. And preventing it, so we prevent it by hopefully vaccinating and washing our hands and staying home if we're sick and covering up our cough and, asking if we think we might have something and we're not sure. We just don't want those respiratory droplets to kind of get in the air. So we've talked about this before, but being careful of other people to me is the most important, right? I think if you're fairly healthy and doing okay and you get the flu, you will probably be just fine. But if you spread it to your 88-year-old dad who's taking care of your elderly sick mom, no one is going to be okay. So just be really careful. And we can diagnose the flu again, but most people don't run in for every respiratory thing they have. So the statistics are probably even higher than we think. And we can treat it just symptomatically. And there are some antiviral medications if you kind of get on those soon enough after your symptoms start. And again, your provider probably won't give that to everyone, right? If you're nice and healthy and you come in and say, test for the flu, they might not give you the Tamiflu and the medication because you're not at high risk to get sick or be hospitalized. But an elderly person, a kid, we might treat. So again, hard to separate. This time of the year is really difficult to separate what people have. Do they have the flu? Do they have RSV? But right now, COVID looks like it's on the downswing. The flu is still kind of rising. So if you haven't had your flu vaccine, we're still recommending that you come in and get it. And if you're considering your flu vaccine for next season, usually September, October are the best months to get your flu vaccine when they time out when the flu occurs. There are some other considerations. If you're in your 3rd trimester of pregnancy, you might do it a little earlier to protect the baby, right? So lots of considerations, lots of things to discuss with your provider if you're thinking of the flu. And there's lots of options for the flu vaccine as well. We grow the stuff in an egg, which that could be a problem too sooner or later. So if you have an egg allergy, there is an egg allergy vaccine that you can get. There are considerations if you're over 65, which vaccines you should get, how many you should get, and sometimes kids will even need to get 2. So just lots to think of. Any questions? Anything?
Mr. Chair, I got a quick question. I know in the past they talked about combining the flu and the COVID vaccines. Are they talking about doing that?
I've heard that. Yeah, you can get lots of your vaccinations at the same time, but I have not heard any more progress.
I just didn't know if they were doing that.
We did include Dr. Lucarillo's News and Views. It's a newsletter we put out quarterly, and it's a combination of health ed and promotion and Dr. Lucarillo. So we wanted to share with you the most recent edition.
Yeah, this has been great. Chris's department helps immensely. Isabella really does a great job. We kind of brainstorm and come up with some ideas, something that's going to be pertinent, goes out to all the providers, hospitals, nursing homes, whoever we can reach with this, we send it out. There's usually some free continuing medical education links in there, so that usually hopefully gets providers to participate and read a little bit more. And we cover, you know, pertinent things like January was Radon Awareness Month, so we put that in there, and the respiratory stuff, and there's usually something pediatric driven, and usually all pertinent things to that time frame.
Are we using like Chat GPT or AI or anything to help us with these types of? Yeah, I think
We develop all of our own material at this time.
that's good. That's good. But it really, I know St. Joseph County, we have a task force, AI task force that we put together, and because I'm on that task force, I get a part of this Chat GPT, and I've been playing with it the last couple of weeks, and it's actually really cool for these types of things. Okay, I want to talk about influenza, and give me some topics that that are important, and it does a really good job.
So we call the information with Dr. Liberello from our sites, and it's like from AMA and CDC and DHHS. So we call the information and then put it together in a format for our presentation.
Well, it's very well done. Great.
Any other questions for Dr. Liberello? Yeah.
Are we hearing much about RSV in children in the communities?
It seems to be on the downswing, so I would say December was a big month. Yeah, November, December were big pediatric vaccines. In fact, I was getting calls from some of those providers about revaccinating people and, shouldn't we? And we usually just follow all the CDC recommendations, but that seems to be on the downswing as well, thank goodness.
Any other questions for Dr. Luttrell? Thank you, Doctor. Moving forward, department reports, and we're going to start with Joe on environmental health.
Good morning, commissioners.
Good morning.
I want to introduce Kyle Moore. Kyle is my general supervisor here at the health department. Kyle's been with us for a few years and has moved up into this position. And I've mentioned him quite a bit in my reports. I just wanted to have him here so that way, if you wanted to talk to him, meet him, by all means, please reach out to Kyle and have a conversation with him. He's been doing a great job for us. Kyle jumped right in and has tackled this division, this section of environmental health, and we're really bringing it up to speed. And a lot of that is because of his very hard work. So I just wanted to recognize him and introduce him to you. So Kyle is here. If you'd like to talk to him. The other thing I'd like to make aware is in your packet, there are extra stat sheets in there, and through quality assurance, we found out that we were missing some numbers, and I wanted to make sure that you guys had those. So we went back to October and brought it up to the front. What was missing was the non-community water supply inspections were missed, so those have been inputted. Those are commonly our type 2 water well inspections, where we go out and make sure those folks don't have cross connections and that they're offering water to the public. So they're making sure that system is safe. And Kyle actually was a big part of that as well. That's what he did before he moved up into the supervisor position. So I just wanted to, full transparency, bring that to you guys, show you that we missed it and that those numbers are now included and will be there moving forward. So we had
Joe?
Yeah.
Before you go too far, I do
Yes.
have a question on that.
Okay.
Your October report shows on-site sewage disposal, 53 permits denied in the month of October. Nothing in any of the other months.
That's an error.
It carries that number through, for year to date, but it's showing. And I went back and I looked at the October report that was in the December packet, and it showed the same figure. And I didn't catch that last month or.
Yeah, I will get that fixed. Get that corrected for you. I apologize. Thank you for bringing that up.
Yeah.
Yeah, we'll get that fixed. So, one thing I wanted to touch in my report before I hit the other things, we had a major retirement. Stephanie Huff was our EH clerk over in St. Joseph County for a very long time and decided that it was time for her to start a new journey. So that was Valentine's Day 2 weeks ago, where she decided that was her last day, and so she is retired and moved on. Her and her husband have a business. I think she'll be helping out there, but that was tough. You know, when you work someplace for 25 years, you think of them as family, and we were excited but sad for Steph. The other great thing is we were able to very quickly hire Steph's replacement. Abby Fader was brought on this week as Steph's replacement. She has been training in Branch and Hillsdale County with Brandy Lennox, our clerk over there, on how to use Hedgehog and how the office operates. She's actually going to be over in Three Rivers starting tomorrow, getting her space set up and learning how to get it going in the right direction. So very excited about that. The other thing that we did that I thought was really cool, we had an all staff meeting, all environmental health. We came together here, and Kyle did some presentations on some of the things that we think we need work on as a team, as a group, and we worked on that. We also had Dee Anderson, our food supervisor, doing some stuff as well. We did one group exercise that I thought was really neat. We took Lego sets and divvied them out into 4 stations. The first station just got the parts dumped out. Second station got parts plus a picture. The 4th station got parts, direction, and that would be the third. That would just be parts and directions. And the 4th was parts, directions, picture, and a helper. And they went through and they got X amount of minutes, 8 to 10 minutes to do this, to try to assemble it. And the point of this was, we've got so many new staff. The older, more veteran people need to understand that you just can't give them the parts and send them out and be able to succeed. We've got to give them everything, so that way they've got the best chance to get the job done right. And so it just was reinforcing how we need to think about training and helping as a teammate, that we're giving them everything they need to do. So that was very well received. It was a great day of coming together and learning. So very proud of that. And then in the food section, we've only had one opening, Mean Gene's Mobile Grill. It's an STFU out of Branch County. I'm not sure. I felt real bad. They got going, and then they've had some mechanical issues with the actual truck that drives around. That's the STFU. So they're working on that. But you may see them out and about in Branch County. They've been going to a lot of the factories and offering meals up there. So that's exciting for them. And we've also been working on getting ready for accreditation in the food program, and the food section's been working on looking at all the MPRs and finding out, is our program meeting those, if there are deficiencies or not, and how to fix them. So that's kind of what we've been doing in environmental health lately. So if there's any questions, I'm more than happy to answer best I can.
Any questions for Joe? Christine? All right, hearing none. Laura Sutter, good morning.
Good morning.
So at your place, you should have an annual conflict of interest and disclosure statement for your signature. Thank you in advance for reviewing that. It is updated based on our last update from last year. The Services to Victims of Elder Abuse program has been going very strong yet this year, and there's additional training and outreach efforts going on with the victim specialists and within some of our law enforcement agencies and with other community partners. And the interdisciplinary team meetings continue in each county, which are proving to just be so beneficial and just a really great opportunity to collaborate and learn about not only what each individual organization's role is, but then how we can best interact to serve our most vulnerable adults in the community. My second update is related to the some of the funding and federal sort of executive office sort of directives and communication that have been
strewn across the news and within the media. We really haven't had any official guidance from our ACLS Bureau, other than a clarification related to one of the service buckets of funding that we call Nutrition Service Incentive Program. So it goes to both of our county Commission on Aging offices as our senior nutrition program contracted providers, and they needed to adjust or realign these NSIP dollars in order to comply with the most recent, the December 20th continuing resolution. So that was an adjustment based on the Bureau's sort of need to bring that back in line across the state. So our award actually was literally cut in half, and we had to immediately notify providers they would not be paid for that request in January, because the request came through or the new statement of grant award came in January. So we are assuming that it will also be affecting February's bill, which is unfortunate. But until we receive another statement of grant award that has those dollars sort of re-awarded, we need to follow those statement of grant awards to the numbers. The hiring that Rebecca reported on and touched on a little bit earlier is exciting. We had our new part-time outreach specialist start on Monday. So I saw her in action late yesterday afternoon with her very first call with a Branch County resident looking for supports and services. So that's always really exciting when you hear a very calm, content voice on our end of the conversation when somebody on the other end is kind of getting in a grip of, well, I thought I was going to be able to handle getting my groceries and cleaning my house, being discharged from a local nursing home, but it's proving to not be super wonderful for me as a single 77-year-old man. So, I was really glad to hear her end of the conversation and sort of walk alongside her as she navigated talking with him about options. And then I did add, a few no wrong door updates. We are still awaiting the formal contract from the lead agency that Rebecca noted, Carewell Services. That's because they haven't been able to sign the contract through the eGrams grants management system quite yet. But those sub awards, the language is out. I've shared it with Rebecca, and it's a very sort of typical sub agreement. And we do have the numbers that should come through, and have our providers, ready and anxiously awaiting to know what the next steps are with these programs, because the health insurance counseling program, will be ending in March, and starting in April 1 will be a brand new sort of administrative structure. And so everybody's kind of just hurry up and wait. It's a little, it's, unsettling, but it's also kind of the way that it has to be for new projects. So we also have the new outreach specialist. Her name is Cindy, and she's also scheduled to go to the person-centered options counseling statewide training that will be held in the second week of March. So that'll be really great training and sort of exposure to her, to the network in this new field. So does anyone have any questions?
Any questions for Laura? Or if Ashley wants to chime in on anything from the ACLS Bureau and any updates that they're getting from the federal government on those statement of grant awards.
This is my. Did you need that?
No, go ahead. We'll get back to Commissioner
This
Schaefer in a
is my
minute.
board meeting in 2 weeks, and I keep hoping that I'm going to be able to share a different update, but no, we're not hearing anything. ACL has been very quiet on really sharing anything. I will say that we're on weekly calls every Tuesday with our national association, and it brings me a little bit of comfort, even though it's not really comforting, but it's area agencies from across the state, and they're all in the same boat. So it's not
you know, it's not just Michigan that we're not getting information, it's just information's not being shared, so. I know, I think Scott did finally, talk to someone at ACL, but I don't think any updates were shared. But I do know that they also had an 11% reduction in, their staff, so they've got their own stuff happening. We were able to issue state and federal funding through the end of March, though. The continuing resolution, as I'm sure we're all very aware, does end on the 14th. So the federal funding in that statement of grant award ends on the 14th, but we were able to carry state funds through the end. So it does go through the end of March. And I'm sure everyone also knows that the House did pass their budget resolution, but the House and Senate are wildly different. So it does not look like we will have a budget before March 14th. So the good news is, I guess we heard on that call on Tuesday that they are looking at a year-long continuing resolution, which would at least give, again, this is hearsay, this is not confirmed, but it's looking like that might be the case, which would at least give a little bit of stability while things are being figured out. I also just wanted to point to that there is a court order that was in place. I think it came out on February 3rd. And it was a temporary restraining order that was entered related to the OMB memo that was related to the funding freeze, which I'm also sure everyone was aware of. And some executive orders that directly tied to federal funding, all of which that led to some pretty big concerns. I'm sure Laura heard from providers. I know all of our area agencies heard from providers, and we heard from area agencies and the Commission on Services to Aging, but that court order, and I'm just going to read a line from it. Federal agencies cannot pause, freeze, impede, block, cancel, or terminate any awards or obligations on the basis of the OMB memo or the basis of the president's recently issued executive orders. So that's kind of what we're working with at this point. The general consensus on those Tuesday calls from other states is business as usual until we're told not to. You know, there are older adults still to serve, and until someone tells us otherwise, we won't be changing any funding that we deliver, and the expectation is still the same. Older Americans Act is still the guiding force of the work that we do. That's the plan.
Commissioner Schaefer, I know you had a question for Laura as well.
I did,
I
yeah.
apologize.
I'm proud. I know that we've been having a lot of discussions about the ombudsman program. Committee. Do you recall, is there more funding now? Did the governor propose more funding, and did the House concur that our ombudsmen are very stretched in regions?
I do believe it is in process. Those agencies that do receive ombudsman funds are getting those dollars in order to expand the number of long-term care ombudsmen in the state. Yes.
Great. Yeah, thank you for that information.
Hiring has begun in the state ombudsman office, so they're going to add to their thing as well. Yeah, it was a major need. That was really great to see.
Yeah, they provide a vital service in the communities that support seniors nursing.
Any other questions for Laura or Ashley? Ashley, thank you for coming down today.
Took a while to get. Yeah. I'll take Bob.
Right. Moving forward, we have Heidi
Good morning.
from Health and Disease Prevention. Good morning, ma'am.
A lot of my report, I think, was kind of already covered, so I'm just going to give some updates. I did include the link for the respiratory virus dashboard if you want to take a look at that. I did get some new numbers last evening about the pediatric deaths. That's now up to 86 nationally and 3 for Michigan. The additional case of avian influenza was from a backyard flock in Monroe. We heard about that yesterday. RSV activity is declining in most of the areas of the country. COVID is still kind of elevated. And like we said, flu as well. I can say for our Tri-County area, the last couple of weeks, cases have been coming down. So I'm happy to see that. Pertussis, Michigan's still seeing some activity. In December, we had 24 cases, but in January, we had 14. So that's looking better. The TB and latent TB infections, we are currently managing those, like Roll stated. Hisdale has about 4, Branch, I think we're up to probably 7, and St. Joe, I think, has 2 or 3 pending that we're gonna meet with soon. Our supervisors have been working closely with the schools to finalize their February reporting. They have to have their immunization status at 95%, which means kids are either up to date or have a waiver on file. And if they don't, they're at jeopardy of losing 5% of their funding. According to some state data that I pulled, gonorrhea and chlamydia cases in our Tri-County area are decreasing, so that's good news. They did say syphilis cases went up from 5 to 12, but that's not statistically significant based on the small numbers that they're using. Becky, you touched on our staffing updates. We're sad to see our peer leaving us, but we will have that open soon and hopefully find a replacement. Our supervisor here in Coldwater is off on maternity leave for 10 weeks. I might be counting down. I'll be very glad to have her back. We do know the WIC conference dates that we held in Traverse City. That's May 8th and 9th. Our WIC coordinator recently submitted the completed WIC cap, the corrective action plan, which is the document that addresses any issues or non-compliances that were found during some audits. So she completed that, turned it in, I believe it was approved. Last month, the Children's Special Healthcare State Accreditation meeting happened for Cycle 9. So they kind of learned what the new expectations are for this cycle, and they're excited to get started on that. Our new hearing and vision tech for Branch County has passed her hearing state certification, and she is now in the school screening kids. And then she'll complete her vision training this fall. The kindergarten oral health assessment program is going strong. Our dental hygienist has been getting into the schools. And it was also nice to hear that the school staff has been very supportive, offering help when needed. And there's a lot of paperwork we're finding out, a lot of data entry, but she's kind of learning how to manage that workload. And her last report to me was she's seen at least 700 students so far. So, and that's all I have for my report.
Any questions for Heidi? Hearing none, thank you, ma'am. Next up, health education and promotion. Chris,
Good morning.
good morning.
So you have the report in your packet. I'll just highlight a couple of things. In relationship to the Office of Highway Safety and Planning grant, we are still on target with our deliverables. Currently, we're working on the vulnerable population drivers education piece and the community education. We're working on developing a booklet for the community with some basic road safety information and state laws regarding non-motorized vehicles. So we have delivered a travel survey to the bishops in the 3 counties, and they are currently working with their congregants to get those completed. And we hope to have the data correlated, hopefully in March, by our next meeting, which is March 11th. The grant for fiscal year 26 is due to the state on March 14th. So I am barely into this grant, and we're writing for the next one. So, but it's going well. The medical marijuana grants, we did not receive anything stating that our applications were deficient. We're just waiting for contracts. So when those contracts are signed by the county administrators, we can get started on that project. We are currently working to get a radio campaign. So in all 3 counties, you'll be hearing a radio campaign in the coming days. We just finished getting all of the audio tracks approved. So be on the listen for a message from your local health department. From a training perspective, Isabella Stoikos participated in the communications training that was offered this month by MALF and MDARF, and she enjoyed that training very much and learned a lot. The community health worker program continues on, and we're still at Covered Bridge Healthcare 2 days a week. We're still seeing clients on the other 3 days through our offices. And we were approached by Wellwise in Hillsdale County with the same grant that Laura's team just received, and Wellwise received the same grant. And so our community health worker will begin working with Wellwise at a future time and date to provide the options counseling and the insurance counseling for those clients. And she will also be attending the options counseling training in March. Our greatest areas of needs continue to be assistance applying for Medicaid, other insurance options. We're still seeing quite a few individuals at risk or currently homeless, and trying to find financial resources to help people with home repairs and food needs and other needs that they may have. And I think those were all of the things.
Any questions for Chris? On those medical marijuana dollars and the education that you're doing on that, are we going to also be using YouTube advertising this year like we did in the past?
So we do anticipate that we will be doing another session of videos that we'll post on YouTube for the public to view and use. We'll also be doing some boosting. We're hoping to do some social media streaming or using some streaming services such as Pandora, Spotify. So.
You know, this younger generation today doesn't listen to the radio like.
No, yeah. But we have had a lot of success working with Spotify. We did some advertising with Hulu recently, and that went well. So now that we have our streaming service partners set up, it will hopefully go easier for us. It was a little challenging our first time out. It took us like, I don't know, 3 or 4 weeks to get an approved video and audio to these folks, but we're much better now. So we have a better practice.
Okay. Any other questions? All right, hearing none. Item 6A. Approval of payments for January 2025. Ms. Teresa.
Morning.
Good morning. Good morning.
There are a couple things I would point out in these January payments. There is on page 38, a payment of, for full construction. That was for the, fixing the water damage in the Hillsville office. That was reimbursed by the insurance company. So you can see that in there. And then on page 39, you'll see the annual unemployment insurance payment. It looks like a lot, but that's the entire year's worth of unemployment insurance that we have to pay. We don't pay the insurance here. We pay the actual costs of money that we sent out in, or that was sent out by the unemployment agency. And that is why that payment is. I would be happy to answer any other questions you have about the bills.
Is the transit authority, is that for the RAP and the buses?
The transit authority would be AAA.
Oh, is that what it is? Grants. Okay, from AAA, gotcha. That's good.
Do I have a motion to approve the payments as presented?
So moved.
Support? Second. I have a motion from Commissioner Hoffmaster and support from Commissioner Collins to approve the January payments as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Next up, the January 31, 2025 month-end financial statements.
So you have the financials for you, and there are a number of programs in the programmatic report that we are watching and will quite possibly need amended in the budget amendment. We are currently 5% under budget. And I also wanted to point out today that we had finished our WIC audit for the FY 22-23, where they come in and do a comprehensive audit of the WIC program. The audit was finished up. We received the final report last week, I think, and it was a clean audit with no findings. And then we also finished our single audit for FY 23-24, which is our large audit here of everything. We are awaiting the report from that, but it appears that they didn't find anything that was concerning to them. I don't have the final report yet, but they did not indicate that there was anything. I'd be happy to answer any questions. Yeah.
Any questions regarding those month-end financials?
Move for approval, Mr. Chair.
Motion from Commissioner Schaefer,
Support.
support from Commissioner Hopmaster to approve the month-end financials ending January 31, 2025. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Next, committee reports, Finance Committee, Mr. Hopmaster.
Yes, sir. Thank you, Mr. Chair. We met on February 14th. You have the minutes in front of you. Much of what we discussed is going to be on new business. We did talk about the audit, having the timing of the audit presentation was discussed. We did not take any action on that, but Ms. Rebecca, do you have any updates on that?
They will be here in person in April.
In April, so it'll be in person.
Okay.
So besides that, I will make a motion to approve the Finance Committee meetings.
Support.
I have a motion from Commissioner Hopmaster, support from Commissioner House to approve the February 14th Finance Committee meeting minutes as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Program Policy and Field Committee did not meet this month. We do have some changes coming up. One would be the bylaws that we did talk about last month. The other one is another revision to the personnel policy to comply with the act that was passed a week ago at, I believe, 11:45 at night and signed by the governor the next day at, I think, 12:30 in the afternoon. So
They have to watch that.
I did still have to watch the vote.
That's troubling.
You don't got it cut.
Had to make sure my sister was working.
Yeah, that's good. That's good.
Keep those siblings in line.
So next before us then is the unfinished business, and I thought the
I think we meant to add bylaws there.
the agenda here before us does not have it, but the agenda online did have underneath unfinished business, the approval of the bylaws amendment that was discussed last month. If you look at your packet, that is in your packet, but it is, I believe, last part of the packet that was there. It is stapled together.
I apologize for that error. I was going to change off the agenda when I made the change late yesterday afternoon, and I obviously forgot to do that.
You'll note on the bylaws, it's a smaller packet there. Bylaws is 2 pages. It was it is stapled documents right there.
So
And as discussed, we had the opportunity this year of Commissioner Hoffmaster was not reappointed by St. Joseph County Board of Commissioners, that we wouldn't have had anybody returning who was the chair or vice chair from the prior year. So just putting in here, much like at our county commissioners meeting, that organizational meeting every year is called to order by the county clerk until the election of a chairperson, just spelling out what happens here should that ever happen at the Board of Health. So
I make a motion, we amend the bylaws as
have a motion from Commissioner Hopmaster, support from Commissioner House to approve the bylaws amendment as presented. Any further discussion? Hearing none, because this is a bylaw change, I will ask for a roll call vote.
Commissioner Hoffmaster,
yes.
Commissioner House,
Yeah.
Commissioner Leininger,
Yes,
Commissioner Collins,
Yes.
Commissioner Schaefer.
Yes.
Thank you.
motion passes 5-0. Thank you. Next up, item 9A, underneath new business, phone purchase. I don't know, Teresa, Becky, Jared, you want to take this?
Discussed at our finance committee. Teresa's team put these bids together, and I'll leave it to you.
Yeah, so we are going to be replacing the agency's aging voice over IP phone system with a new voice over IP phone. The first step in that process is purchasing the phones for that. We did reach out to 3 different companies to get the phones themselves to get good pricing. What we determined was that the Telnet, who is going to be the phone provider themselves, their quote is a little bit more than getting the phones from the other providers that we sought out bids for. But there's also, it doesn't cover the entire cost of the difference in the quotes. But there is a bring your own phone upcharge if we go with one of the other two vendors that's not Telnet. It doesn't cover the entire cost. It's about a $2,000 difference. So if we go with the Telnet bid, which is what I'm recommending, we will pay $2,000 more, approximately $2,000 more in charges. However, those phones come to us already set up to work on their system, so our staff does not have to do that. So that is the difference. We will be paying more, but our staff will not have to do that.
We also discussed in the finance committee too, that correct me if I'm wrong, Teresa, Telnet is a service provider and then would be the equipment provider as well, right?
Yes.
So if we went with Telnet as a service provider and somebody else with the hardware, then you have people pointing fingers at each other and it's our fault, it's their fault, that type of thing. So we felt like the premium was justified in just having it set it and forget it. It's easier for the staff and I think it's justifiable.
There's a motion to set that bid.
Bid from
Telnet. Yep. I support that.
Have a motion from Commissioner House, support from Commissioner Hoffmaster to accept the bid from Telnet. Any discussion? I guess the question I would ask is, are these local funds that are used to pay for this? It's the grant funding underneath the facilities update grant?
It is grant funding under the infrastructure grant.
Okay. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Those opposed, motion carried. Next up is the additional electronic door request. On page 51 of the packet in front of us. I think it's a different page if somebody's looking online.
No, I didn't remember.
Well, you did online because you have the bylaws inserted in there.
But I didn't renumber the pages.
Yeah.
Those three bylaw pages did not have numbers on
Okay,
them.
I see. So, Teresa, Becky, Jared, which one of you wants to take them? We have a bid. How many more doors?
3 more doors. These are the door to the elevator, the lower level, the door to MCDC, which is also on the lower level in the hallway. So it's kind of like their back door from the hallway. Help me out with a third spot.
The mechanical room.
The mechanical room also in that hallway on the lower level. So we did have some concerns voiced to us about items in MCDC that they felt were walking out the door. If we can get another fob on that and have better control of who has entry and just get rid of the keys. And the elevator and the mechanical room would be well served to also have those ads. So this is just the fob ad. The equipment exists. So it's, you know, we're utilizing existing equipment, adding additional security. Do you have anything more to say?
I will entertain a motion to approve the bid from Michigan Security and Lock as presented.
So moved.
Have motion from Commissioner Hoffmaster, support from Commissioner House for the bid from Michigan Security and Lock. I believe that is for $6,549. Was presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Up next, item C, no wrong door grant staffing. We've heard about this from Laura and Becky and Ashley today, so. And even from Chris. We'll be doing it, but through a different area of aspect, so. Do I have a motion?
I make a motion, we accept the grant
Support.
And approve the,
and approve the hiring.
we have a motion to accept the grant and approve the hiring as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Next in your packet, and I believe that there's one in the packet, and then I think Ms. Laura put another one. The next one there is the AAA conflict of interest statement. Please sign that, print your name, answer the question whether you do or do not have a conflict of interest, and return that to Laura before you leave today. Next is item 9E, and that is a separate paperclip document there before us. Some additional updates to our agency personnel policy manual. As you can see there, these updates were all necessitated, required because of the changes to the Earned Sick Time Act that were approved and signed into law last week by the governor. They are highlighted, the changes are highlighted there on the cover page and then in red throughout the document. Again, because of the timing of this, the personnel committee did not have time to meet to actually, Program Policy and Appeals Committee did not have time to meet to discuss this, but because that law took immediate effect, there are changes that we do need to make to that policy that we approved at the last board meeting.
If I may, our Personnel Policy Committee also has not met to look at this yet. But we will be meeting with all staff today and we'll make sure that everything is brought to everyone's attention. We felt it was necessary to act very quickly because of the change in the law.
And these changes were reviewed and suggested by our legal counsel. So I will entertain a motion to accept the updated personnel policy manual as presented.
Make that motion, Mr. Chair.
Support.
I have a motion from Commissioner Schaefer, support from Commissioner House to approve the program personnel policy manual changes as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. That brings us up to item 10, public comment. Don? All right, no public comment, commissioner comment, any commissioner comment? All right. Our next meeting will be March 27th, 1 month from today, back here in this room. I will entertain a motion to adjourn.
So moved.
Support.
I have a motion, from Commissioner Hoffmaster, support from Commissioner Schaefer to adjourn. All those in favor say aye.
Aye.
All those opposed, carried.